South Africa is one of 12 African countries that have committed to ending AIDS in children by 2030. With the largest population of children living with HIV globally, however, treatment coverage as of June 2023 was recorded at just 56% for children and youth up to the age of 19. To discuss this, we are now joined by Gugu Shongwe, CEO of Save the Children South Africa. Thank you so much, ma'am, for your time this afternoon. So a number of reports, show just how South Africa's high infant mortality rate, as an example, is driven in part by the high rate of transmission of HIV to children. Just your thoughts on this new initiative, and also maybe just share and give us a sense of how prevalent HIV infections are in the country from the work that you do with children.
Good afternoon, Nonati, and good afternoon, South Africa. And thank you very much for giving Save the Children South Africa the opportunity to be talking to this situation with HIV and AIDS and TB. And as we know, as a country in the past 10 years, the transmission of mother to child HIV transmission went down. It went to even below 2%, close to 1 point something, which means the ability of South Africa to get mothers who are pregnant to be tested for HIV in order for us to know that this is a vulnerable pregnancy, and let's make sure that we provide required treatment to the mother so that we can reduce transmission to the child, has been successful, and South Africa has been congratulated for that. Now, what is our biggest problem is that when a mother does not attend the clinic and is not tested for HIV, and that is at about maybe 6% of the mothers that fall pregnant that don't get to clinics. We've got above 90% that are tested. But now the percentage that is not tested is now exposing this unborn child to be born and be HIV positive, such that we find the positive children at delivery, because even at delivery, our hospitals are testing babies. Now we've got the percentage then of those that are positive. And those that at times, very few though, are born out of hospitals and raised and later brought into the hospital or clinic, then again, that would be a number of HIV transmissions that have not been picked up in the right system. So that tells you that, yes, we do have a percentage of children that are HIV positive born mainly. And remember, we also have a high rape rates in terms of children who are raped by adults. Some of them are positive and some of them end up being positive. So a child has these multiple opportunities for being exposed to the virus. Now, once the child is HIV positive, either known or unknown, there's a need for the carer or the parent to assist. Assist by making sure that the hospitals are aware, the hospitals are taking the required bloods and putting the child on treatment, because we do have pediatric HIV treatment. So they need to.
Ms. Shongwe, before we start talking about those interventions, and I want to get to that because I think they speak to some of the solutions, just in terms of what you've said, given that South Africa still experiences at least, I think, 1,000 new HIV infections in children. I want us to talk a little bit more about the drivers here. I mean, you did mention, of course, giving an example of mothers not being tested and, of course, cases of rape. But also, what urgent interventions then are needed in as far as those drivers are concerned that could be tailored to address some of these challenges?
Okay. As Save the Children South Africa were involved with the South African National body that deals with the populations, which means we've got community-based organizations that have been educated on what needs to be done at a community level. This includes education of communities. We're educating a caregiver, a parent, and a child themselves. We're providing education in schools or providing education in churches, in almost all platforms. One, on how we should prevent HIV from being transmitted. But we also educate communities on what the signs and symptoms look like and what is the best way of knowing. And the best way of knowing is to get to a clinic, and request to be tested. Whether you're a child or an adult, you can be tested so that you know. So knowing your status is the best thing communities can do, because once you know, then you have a better chance of getting the required treatment, let alone the fact that we are also talking about the fact that there's transactional sex. It exposes even young girls mainly to being infected by HIV by adults that are paying for the sex. So we're educating a lot of young girls about saying no to sex that they have not planned for, and saying no to sex simply because you want the money that is being provided. So dealing with transactional sex is one of the big things that we're dealing with. For instance, the trucking community, in the routes that they travel in, they also expose young girls to wanting to get money for sex, which is something that we're discouraging. The other thing is Save the Children, because we deal with the rights of children. When a child that is 10 years old falls pregnant, the parents need to stand up and look for justice to say what happened, because this is a minor. How can an adult or whoever impregnated that child be allowed to roam around without answering for why they had sexual intercourse with the child? So justice also needs to come in so that we can be able to reduce the number of young girls pregnant. Honestly, some of them, if they're 10 years old, they're not even yet teenagers. Yeah. So we do have a problem again in that area.
And that does speak to rape. You know, one of the things, of course, that you mentioned is with all of these infections happening, what is also of concern, you know, just given what is now, you know, happening in terms of South Africa being one of those countries committing to ending HIV and AIDS in children by 2030, is that treatment coverage is so low. You know, how do we then increase the treatment coverage in children specifically? I mean, at the moment, it's sitting at about 56%.
Thank you for that question. Look, as soon as we have 56% treatment rates in children, it makes us to look at the adults that are around the children. One, because you've been taught about the signs and symptoms, you've been taught about the need to get the child to the clinic. Because at the clinic, a child is weighed. We've got a road to health chart that shows if a child is thriving well. Now, if the child is not growing well, the nurses in the clinic also have an ability to see that this child is not growing well. What could be the reasons? They need to sit down and get to the bottom of it. The other thing, we've got community-based organizations who sit with mothers in their different homes and look at the health of the child. And clearly, the adults that are around the child need to answer to say, what is it that we did? For instance, we've got a lot of malnutrition in South Africa. Right now, we're at about 23%. Again, if the child is eating well, and the child is being taken care of, we are not going to be able to pick it up easily. But if the child has malnutrition and other illnesses, then the clinic needs to come in, which means we are saying, mothers, please take your child to the clinic if you do not understand the rate of growth of that particular child, and make sure that they attend to the child. And let's do all the required tests so that we can exclude TB, so that we can exclude HIV. In that way, we can be able to pick it up as early as possible. But the very important thing is that mothers should be responsive to the needs of their children. They should look at the body of the child, the skin of the child. They should be able to identify something that they are not happy with, because there's a difference between a skin of a child that is growing well versus a child that is not well. And so stand up and ask for questions and try and get answers soon enough so that the child can be put on treatment. And then as soon as a child starts treatment, parents need to be responsive. They need to come, because we see a lot of them not coming back for the next treatment because they've gone somewhere else to look for treatment. They don't believe it's HIV. So all those things are important to be attended to.
Thank you so much, Ms. Shongwe, for your time. Really do appreciate it. Gugu Shongwe, CEO of Save the Children South Africa.